I'm pretty sure it's nothing new to you that a lot of people, a lot of young men and women use stimulants. Even older adults use stimulants. And there are a series of reasons why people use stimulants. Let's talk about the reasons why people take stimulants. I'm going to categorize them into two. One is for medical reasons, and the second one is for non-medical reasons. Now, the medical reasons. If you have ADHD, medications like Adderall, Ritalin could be prescribed to help increase your focus and control your impulse. For people with narcolepsy, stimulants are prescribed to help them stay awake. For weight loss, there are some stimulants that help to suppress appetite so you don't eat too much. And also for asthma, we have stimulants, medications that help to breathe better. It will open the airway. An example of that is theophylline. Now, the second category, which is the non-medical reasons why people take stimulants. People take stimulants to increase their energy and alertness, most especially for students who are studying for examination. They want to stay awake and study for a longer period of time. Also, for professionals, they want to stay awake while at work. They don't want to fall asleep on their desk. Some people take stimulant for the love of it, for euphoria. It makes them feel high. It makes them feel better. They just love taking it. Among young adults, they take stimulants because of peer pressure. They believe if they don't take it, they don't belong to that group. Sometimes they feel inferior. Some people take stimulants to cope with stress or depression. People take stimulants for different reasons. Now, here are the common stimulants people use. Number one is caffeine. Number two is nicotine. Number three, prescription stimulant like Adderall and Ritalin and modafinil, and of course the illegal ones. Out of all these, the most common stimulant in the whole world is caffeine. About 90% of adults take caffeine every day. And what are the sources of caffeine? People get caffeine from coffee, black and green tea, soft drinks, energy shots, chocolates, protein bars, sports and energy drinks, chewing gum, and even ice cream. The American Academy of Pediatrics discourages the consumption of caffeine and other stimulants by children and adolescents because of caffeine toxicity. And remember, stimulants could cause changes in the heart rhythm. You could have abnormal heart rhythm, and sometimes this could be very dangerous. Now, let me tell you about the dangers of taking stimulants, and maybe this could help you take a decision to step away from all stimulants. Stimulants increase your heart rate and your blood pressure, and this can lead to heart attack and or stroke. It will also cause you sleep disturbances because you stay alert, you stay awake, you can't sleep, and this gives you headache and a lot of things goes on in your body. Your body cannot rest. Taking stimulants could cause loss of appetite or lead to malnutrition. Stimulants could lead to dehydration and overeating. Your body temperature rises because your body is depleted of water to cool down. Your muscles become tensed with headache when you cannot rest. Those are the effects of stimulants. Taking stimulants could lead to anxiety and panic attacks, depression and mood swings, psychosis and hallucination. You could hallucinate. You could see something that is not present. You may be hearing things that are not actually true. It could ultimately lead to addiction and dependence. You gotta stop. Taking stimulants could have social and behavioral consequences. For example, risky decision making. Things that are not making sense, you might be doing them. It could cause financial problems, strained relationships. It could lead to legal issues because a lot of problems are coming your way. If you are trying to stop taking stimulants, these are the signs you should be expecting. Some people might not feel anything, and some people they might feel it the worst way. These are called the withdrawal symptoms if stopped suddenly. This implies that if you want to stop taking stimulants, you have to stop it gradually over time. You may need to consult your doctor to help you stop taking stimulants. Now, how do you know that you are withdrawing? There could be extreme fatigue and drowsiness. You may experience depression and irritability. There could be strong craving for stimulants, for that stimulants or that substance you are abstaining from, you are running from. There could be strong craving for it that you need it to be normal again. You may have difficulty concentrating. There could be increased appetite and weight gain. So if you are trying to stop taking stimulants, please, you need to know that it should be a gradual and steady process. I will advise you to consult your doctor because stopping stimulants suddenly or abruptly could cause you to have these symptoms. If you need further clarification, further information, please drop your comments, your questions in the comment section. Thank you so much for watching and thank you for being a follower. If you're just coming across this channel for the first time, please hit the subscribe button so you'll be notified when I upload my next video. Thank you so much for watching and good seeing you again.